Is a benign needle biopsy always good for lung cancer? Imagine getting a test that shows no signs of cancer and feeling relieved. But in lung health, a benign result from a needle biopsy isn't always the final word. Needle biopsies, like fine needle aspiration or core needle biopsy, are common tools used to examine lung lesions. They are generally accurate and helpful for diagnosing lung cancer, but a benign result needs careful interpretation. The accuracy of these biopsies is quite high overall. They can correctly identify benign or malignant lesions most of the time. For example, the chance of correctly diagnosing a benign lesion is often above 90%. However, the sensitivity for detecting cancer, especially in malignant cases, can vary from about 77% to over 90%. This means that while a positive result for cancer is usually reliable, a negative or benign result doesn't always rule out cancer completely. Smaller lung nodules, especially those less than 2 centimeters, can be more challenging. The accuracy drops for tiny nodules, particularly those under 6 millimeters, where false negatives can happen more often. Factors like tumor heterogeneity, where different parts of the lesion have different cell types, or technical issues during sampling, can also lead to false negatives. So, a benign biopsy might sometimes miss cancer that is actually there. If the clinical picture and imaging studies suggest a high risk of cancer, doctors often recommend additional steps. These can include repeating the biopsy, trying a different biopsy method like navigational bronchoscopy, or closely monitoring the lesion with follow-up scans. The goal is to avoid missing a cancer diagnosis or delaying treatment. It's also important to remember that needle biopsies carry some risks. These include pneumothorax, which is a collapsed lung, and bleeding. The benefits of getting a diagnosis must be balanced against these potential complications. In summary, a benign needle biopsy can be reassuring, but it is not always definitive. Doctors consider the size, location, and appearance of the lesion, along with the patient's overall risk factors. They may recommend further testing or follow-up to ensure no cancer is missed. Always consult healthcare professionals to interpret biopsy results in the context of your specific situation. Medical decisions are complex, and personalized care is essential for the best outcomes.